Welcome to the Inspired Hygiene Podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Hello, everyone. Welcome back to the Inspired Hygiene Podcast. So if you've been listening this season, you know that we are talking about how dental teams cannot just dabble in innovation any longer. It's time to really integrate integrate and innovate in your practices to thrive in 2026 and beyond. And so today I'm super excited that we're going to be diving into AI and technology integration. And for a lot of practices, AI still feels like this shiny object. Like, okay, we have this new toy. What do we do with it? I know a lot of times we see teams use it for one small application when really there's so much more that can be done, whatever the technology is. And the truth is that those things can be so powerful for improving diagnosis, documentation, systems, patient communication, team communication, if it's really used with intention and if the team is calibrated around it. So I'm joined today by two brilliant guests who are leading that charge in our industry, Alicia Maria and Laura Nelson. Thank you both for joining me today.
Thank you so much for having me, Rachel.
Absolutely.
We started talking ahead of time. We're all into this. This is going to be fun.
I know. I love it. I love it. All right. So, Alicia, you and I met, probably 10 years ago. You're a dental hygienist. You have had extensive experience with technology integration in multiple teams as a hygienist, as a dental coach. You have founded Hands on Demand. You've worked with Inspired Hygiene as a coach, and you're now a regional dental hygiene coach with Dental Care Alliance. So you have a incredible amount, I would say, an unusually extensive amount of experience with this and seeing how different teams integrate technology clinically. So that's why I invited you, because I would love to hear your insight on this. But tell everybody a little bit more about Hands on Demand.
Sure. Hands on Demand was birthed from my clinical experience and my expertise as a clinical faculty member with Align Technology. And I noticed that there was a gap in education in terms of teams really wanting to get that hands-on clinical education and experience on scanning. So most times when you go to a conference, you'll find opportunities to go to a clinical hands-on course for digital scanning, but the attendance opportunities are very limited. One, because scanners are $30,000 plus, and they can't really get more than 5 or 10 in the room at a time. So that limits the amount of attendees who can actually participate. And even when they're participating, they may not have a full opportunity to really engage all of the features of the scanner because there's a long line of people waiting behind you. So Hands on Demand was truly designed to help individuals who have a scanner in their office, as well as intraoral photography in their office, really utilize this technology, but not only just utilize it, but understand how do you apply it to your everyday practice and use this technology for case acceptance. Because at the end of the day, I truly understand from my experience as a coach and a clinician, when you add that piece of visual technology into case presentation, the patient understands what they really didn't understand before, and they start to ask you questions, and they want to understand what can we do next in terms of my oral health. So that's where Hands on Demand was birthed, and it's just like a hodgepodge or like a baby of all of the things I know and love about technology. And I'm a huge champion for adding it into a workflow, and I've seen it work.
So how do practices utilize Hands on Demand? Is it an on-demand course? Is it you coming into their practice and working with their scanner, helping them integrate that? How does that work?
So Hands on Demand is actually going to be released later this month. We're in November, later this month on CE Zoom. And you'll have the opportunity to purchase that course on CE Zoom and have access to it on demand. So as you're in your practice, you can open up CE Zoom, use your login, and it is designed for you to use it while you have a scanner in front of you.
Love it. Love it. I love
And if
that.
you need me after that, then you have information within the program on how to contact me for more
Okay.
detailed support.
Okay. Perfect. And we'll see if we can put some information on that in the show notes too. Okay, Laura, you and I have also known each other for a long time. We first met, gosh, probably through Speaking Consulting Network, somewhere in that lifetime there. You are the founder of Front Office Rocks, which so many folks in the industry are very familiar with. And you are an expert on AI integration, speaking on that all over the place. And recently you joined Mango Voice as their VP of AI. So tell us a little about that. And then you have a book that you are going to share with everybody.
Yeah. So thank you. Yeah. You and I met, I don't even want to say how many years ago. It adds up fast, doesn't it?
Yeah.
Um, But I started Front Office Rocks 15-ish years ago, as a way to train teams. So I think Alicia and I are both on the same page. Like teams need the training. And a lot of times doctors go to CE, they come home, and then the team's like, cool, but how do we actually implement these changes you want to do? And so I've always been focused on team training. Front Office Rocks is off and running. I'm a speaker around our industry. And then lately, for myself in the last 2 years, I've really gotten into AI because I use it in my everyday life. And I finally see it as a solution to problems we haven't been able to fix with what we've been doing thus far, right? Because the biggest thing we have across our every practice, no matter where you are, is there's not enough time in the day. Everybody's got a million things to do and we're running around with the schedule running us and there's not enough time in the day. AI is the solution to a lot of the busy work, a lot of the things that we do. So I jumped into AI myself personally because I saw it as a solution. But then I started seeing every company in the world popping up in our industry saying, we have AI this, AI tool, AI, right? And the issue is a lot of these companies might have an AI solution, but they don't know dental office operations. They don't know how does that actually apply in our practice. You know, you can have somebody book in your schedule, but they don't know how a dental office runs. So if AI books someone in our schedule, it's going to cause havoc if they don't understand dentistry. So I started working a lot with companies that I wanted to make sure we're focused on both AI and the technology, but also true dental operations, which is how I started working with Mango Voice before joining them, because I believe Mango Voice is doing that. They found a way to, at the end of a phone call, summarize the notes and put it right into the practice management software, which is phenomenal because we've never had a way to know what actually happens on those phone calls. So in conversations, we started talking and they are very interested in making sure that they stay aligned with what we need in the front office for dental offices. So I've come on as the VP of AI to help guide the AI within Mango Voice. And I wrote a book called Brush Up on AI, which I have here. It's on Amazon. There's a Facebook group on it because kind of like in the beginning when I started training teams on what the doctor's thinking and what needs to happen in the practice. Now I'm here to help teams go, okay, cool. AI is amazing. Great. But how do we actually apply it in the dental office? And where we are now and where we're going to be next year and 3 years from now, it's going to change, and it's going to change faster than we've ever seen it before. And so I love that you're having this discussion now, because when we used to sit back and wait and one day we'll get to it, there's no sitting back and waiting anymore because it's coming super fast. So I'm all about this subject, and I love that we're here talking about it.
That is a perfect lead in, Laura, to this podcast. And we will be sure and put a link to your book in the show notes as well. You talked about really truly integrating this into consistent use within the practice. So that's what we want to talk about today. And I think we could probably do a whole nother episode or season on specific AI and technology applications that are relevant to the hygiene department. So we'll put that on our list as well. So the first question I have is, you both have seen practices bring in a new technology tool and they're excited, or very often the practice owner is very excited about it. And, the team probably doesn't know anything about it. And then one day they're like, hey, we have this new tool. And everybody's like, really? Like, what are we supposed to do with this? So there are a lot of different ways that this is introduced into practices. Sometimes it is that. Sometimes the practice owner gets excited and purchases something, and then all of a sudden everyone's expected to know how to use it. Sometimes it's a team discussion. Sometimes it's purchased like in a DSO, it's purchased by the leadership, and it's brought in. And again, there's not a lot of communication into the why did we bring this in? What is the vision for how this is going to help the team? And here is the support tools training that you need to fully integrate that. And is that the expectation? So I'd love to hear from both of you. You've seen this happen. What separates the practices that actually integrate these technologies into their daily workflow? And you can speak to AI specifically or just general technology, however you feel most comfortable. But what separates them from integrating it to those that just kind of see it as a new gadget, and then it ends up, in their software stack and it's not being used, or it's in a corner somewhere?
I can honestly say that I've seen AI integrated most successfully when the team fully understands the why. Why is this technology and this AI being integrated into our office now? And it's usually centered around a standard of care. And if practices typically don't own a standard of care document, or they don't have a standardized operating procedure, when we integrate technologies, it just becomes another thing that we have in our office, and no one really understands why we're using it, when we're using it, and what does this mean to our bottom line, aka our overall patient care.
Mm-hmm. It becomes
And I,
one more thing to do.
Mhm.
right. And I would add to that. So AI, even though I'm VP of AI, that's my title, is such a buzzword.
I
And
love that.
when you actually think about it, it's just new technology. So I love that Alicia said that it's just new technology. It's just a little different than we've had in the past. We're at a spot now where, they call it a light bulb moment. It's where this new technology is in the hands of the average person. Just like when they gave us a light switch, now we can control the lights above our head by turning a switch on. So when we actually think about it, it's new technology. And just like any other technology you've looked at in your practice in the past, starting with why do we need it? Like you said, what problem are we trying to solve with it? Like, don't just go buy the shiny new tool and put it on because it's going to sit on a shelf. I speak in front of dental office managers all the time. And there was one who said to me, we have a 9-day rule. If our doctor brings back something or wants to do something and he's still talking about it in 9 days, we'll consider it then. Because there's so many things that we've wanted to do, right? So I think it's literally a matter of like, what problem are we trying to solve? You can't go turn on every new piece of technology. There's stuff in hygiene, there's stuff in clinical, there's stuff in the front, but is it going to solve a problem for you? And then when the team's involved, like you said, Rachel, to say, this can help us, this will help us fix a problem maybe we didn't know we had or we need to fix, then they're going to embrace the idea much more.
So in episode 1 of this season, Jennifer and I talk about that. Like, how do we have this collaborative approach to bringing this technology in? Yeah, Alicia.
I was just going to add to Laura's point to this new shiny piece of technology and what does it do for us? I think the other most important question is, what does it replace in our office? And we know that AI does not replace a person, but what system does this currently replace for us? So if we have a standard of care and we say we update an intraoral photograph for every new patient, right? And now we add a scanner into the fold. What are we replacing? Are we using the scanner in place of intraoral photography? And if so, how does that improve our bottom line, the patient understanding their oral health status at the end of the day and saying yes to our recommended treatment? So if we can say that this is going to replace, a couple of intraoral photographs, let's try it for the next 30 days. Just add that in place of our standard of care. We'll know when we're putting it into our workflow. We'll know why we're putting it into our workflow, what it should be replacing. So we're not doing too many of the same things, because AI is essentially designed for us to work smarter and not harder. So at the end of 30 days, if we feel like this is working, we know that we keep this in our standard of care. If not, we have to figure out another solution for us to do the job that this AI was designed to do for us.
Mm-hmm. I love that. And another example just that came to my mind around scanning is, for years we all did charting of existing restorations, which takes forever and is super tedious. And so now if you're doing a wellness scan on a new patient, done, right? It's all there.
Period.
So it's replacing something that took a lot of time, and not only replacing it because you only want to replace it if it's giving you an enhanced result if you're getting a better image of what's actually there than you were before.
I
I will tell you the worst words we can hear though in our industry is this is the way we've always done it, right? This is how we've always done it. And so when you are looking at what you're integrating, I always ask the question why, right? And if a team member is doing something, they can't explain why we're doing it, that's a really good time to look at it and say, are we just doing it because that's the way we've always done it? And now is there a better way we can do it? Like you said, Rachel, like, is this going to enhance? Now, my big red flag that I see for our industry, I'm putting this out there, 2026, hopefully I'm wrong, is our team, our industry, our culture. We are addicted to being busy. We are addicted to running behind. We are addicted to having the schedule run us. And so one of the concerns that I see is that with, like Alicia said, was great. AI is not here to replace people. It's here to make us work more efficiently. But humans have this, besides going through change, we have this concern of if I'm efficient and I can get all my work done, what about job security? What do I spend my time on? If I don't have a million things that I have to do, what do I do? And we all have to admit we have backdoor problems in our industry. And the two reasons people are leaving our practices is we don't give them a good customer service and we don't run our systems well. So when you lean into technology that's going to help you be more efficient, we have more time now to run our systems well, to do your handoffs right, to have your morning huddle, to have team meetings, to do the systems you should be doing. And we have more time for patient-facing things, right? More time for case presentations, more time to spend with the patients. But that means we have to have the humans realize that their role is changing. And also on top of that, we get to go to lunch on time and we get to go to our kids' sports games in the evening because we're leaning into making ourselves more efficient. But we've never had that yet fully in our industry. And so that's going to be the biggest change is the humans are going to have to, like, I know when I started playing with AI, what I did is I got 3 times busier because I was doing so many things. I was like, I could do this. And finally I was like, wait, this wasn't meant to make me busier. This was meant to give me time to go, to dinner with my family and not have a million things on my desk at the end of the night. So we really have to be careful about the human side of our industry when it comes to bringing in technology.
However, what you're saying is it's actually has a potential to allow us to be more human and to have more human connection.
Which,
So
think about that. We already talked about how dentists in the past in dental school weren't taught how to run the business. So there's all this business knowledge and stuff. We also now have to talk about our people in the offices. Our dentists weren't, this is more patient facing time now, right? For our team members, we have a younger generation coming in that they're not super great on the soft skills when it comes to the human side of things. So there might be some fear of, oh, wait, I actually have more time to talk to humans. I don't like doing that. So we better work on the human skill, right? 100%.
Yeah. Yeah. That's a really interesting take on it. How do you see that showing up clinically, Alicia?
I was just going to speak to that point, and I love that you brought that up, Laura. I am of the belief that patients trust AI. And they trust us more when they know that we're using AI. So before this call even started to record, we even discussed how AI was starting the conversation for us in this podcast. Smart people use AI to help to develop a better human connection. So when patients know that we have consulted with AI and we can show them how AI has helped us to deliver a more succinct dental hygiene diagnosis, patients are more likely to say yes to what we're recommending. So yes, it does add a more relevant human connection because we know, I would say, I don't have the statistics, but I'd say 80 to 100% of our patients are using some form of AI on their cell phone in our chair. So when they know we're using it also, that's another way for us to connect. This AI is no different than what you're using in your phone.
And I love this. It's like, if the interview between two ferns, I forgot what that show is. I feel like I'm the front office between two hygienists here. Like I'm, but I have a story about this when it comes to hygiene. I went to my hygiene appointment, and I'm not going to say the companies because it doesn't matter, but my dentist has AI in their practice. And I knew it. And so when it came up on the screen, I took a picture real fast because I was like, oh, look, AI. And that hygienist said the words, oh, I'm looking at AI, you're fine. And she slid it away. I saw it for literally 10 seconds. And so I talked to the doctors later because I'm friends with them, and they're like, yeah, and AI is not integrating well in our practice. It's not going well. My husband went to his dentist, and he knows I talk about AI. He listens to me on these podcasts. His hygienist brought it up, said, hey, I'm using AI. We use this as a second opinion to help us diagnose. Here's what you see. He came home like he had a dental degree with me and explained to me everything that was going on in his mouth. So when I talk to hygienists who are like, well, we tried the whatever AI, it doesn't work. The AI, yes, there's still issues that come up with technology. It's not perfect, but it does work. That's a human training issue. That's an implementation issue between those two practices, right? And so that's really where, like, if it's not working, it's because your system's not working. Your training didn't work. Your all the things we were talking about didn't happen when you brought in that new technology.
Yeah, I'd love to speak to that because I've seen, and I was just in a practice this week. So I've seen a couple different things. If we'll speak specifically, and again, we won't name specific companies, but just some things that people want to look out for. And Alicia, please chime in on clinical things if you've seen this too. Is specifically around measuring attachment loss and bone level. I've seen some cases where the AI uh, isn't fully identifying the true bone loss because it's measuring shades of gray. And then, yes, this week I was with a team that was using a different platform, and it did surprise me how well it was identifying that. And really, what it came down to was differences in bone density from like the facial plate to the lingual plate. If you are looking for that, and a lot of hygienists are not. That's one thing we teach is how do we look at the nuances of these radiographs to give us evidence of whether or not this patient has bone loss. And we always find when we're educating hygienists on that, they're like, okay, I'm glad you reviewed that with me because I wasn't looking at it that closely. And some of these AI tools are catching it. Some aren't, but that just means that it's still relying on our clinical skill and judgment.
Absolutely, Rachel. And I'm so glad that you brought that up. And I think about radiographic interpretation and some of the softwares that are associated with it. I couldn't shout this from the mountaintop louder. We have to ensure that we are integrating this software and everyone on our team understands the best practice for this software.
Mm-hmm.
So, in my clinical experience and my experience as a practice coach, I have had opportunities to work with clinical trainers. So when they put this software in your practice, they show you all of the features that are associated with this software. And if you're not aware and you have a new team member and they're not privy to the nuances of this software, it's not being fully utilized. One of the things I realized, and to your point, Rachel, about the density and the bone levels, is we as humans have to train AI. So if AI is saying, here's an incipient lesion, on the right-hand column of most of these AI radiographic interpretation softwares, it's going to have a trash can. And if you disagree with this incipient lesion and the dentist also disagrees with this incipient lesion, you delete it. And what we're doing is training this AI software that this is not an incipient lesion. So the next time you see it, there's a 50% chance that it's not. Okay.
Mm-hmm.
So we have to train AI. And the more we get in depth with the integration side of the software, not just saying, oh, it's there, they want me to use it. You have to get in the weeds and really
Yes.
understand how this software is here to aid us and not really take our position, because we have to be the one to say, yep, I'm noticing that this bone level is not the true measurement. So I'm going to delete this one off and use it on the following slide and not this one, because you can delete the bone measurements off on one of your right wing films and not the other. So if one says it's 1.8 millimeters of bone loss and the other says 2.0, and you're visually seeing 2.0 millimeters of bone loss, you can delete the 1.8 off of the other film. And you're training AI to what to identify and what's truly millimeters of bone loss. So
Mm-hmm.
I'll
that goes in.
I'll add to that too, that we have to remember how connected we all are. So I've heard a story of this similar thing. And again, I'm not a hygienist, but where an office was submitting things to insurance, and what they were seeing on AI and the way they were probing and the way they were documenting weren't aligned. Now we have to remember insurance also has AI. So they can see it now and they go, oh, wait, hold on. We're not paying this because this doesn't align, right? And on top of that, now we're going to come back and audit your last 6 months of radiographs. And so I think it's so important, Rachel, what you're talking about is that the hygienist, the dentist, as they're using this technology, it goes from them to their insurance, to their front office, to the team, that we all are using the same words, that we all understand what goes to. And I mean, this has always been the case. Like what we do in the back, we need to know for the front to bill the insurance. How we talk about perio with our patients needs to be the same way that our hygienists talk about. Like all of that matters. But AI is going to, it's going to exemplify this. It's going to make it a bigger issue and problem. And I think we're going to talk about this a little bit about like, if you're not doing good systems in your practice, AI is going to make it worse, or
Yeah.
it's going to make it bigger, right?
Yes. So yeah, go
Laura,
ahead.
I was just going to speak to the standard of care. And if we are all trained to look at 2 millimeters of bone loss plus 4 millimeters probing depth that has bleeding on probing documented, we all know what to do if we see that. So this is just one piece of the puzzle that we need to add the other human element to. And we have to put all of these things together to develop a comprehensive dental hygiene diagnosis.
Yeah. That's guided by that common standard of care. So we keep talking about that. We'll put in the show notes a link to a standard of care worksheet that we offer for free at Inspired Hygiene to get you all started on that. But I had a multi-location group ask. They were not seeing any growth in their hygiene department. We identified that there's potential to grow in periodontal diagnosis and treatment. And they asked, well, we're considering bringing on AI radiography analysis software. Won't that fix that problem? And I mean, the conversation was more nuanced than that, but that was essentially what it came down to. And I said, no, it's going to amplify the fact that you do not have a clear standard of care, and that the current way that your team is diagnosing is not capturing all of these patients that have active periodontal disease. So it's a great tool when it's coupled with very clear clinical standards. Everybody understands the why behind those clinical standards, right? It's not just to increase production, it's to really address active disease. And so that when the hygienists are performing a prophy, it's actually a prophy and it's not undercover scaling and replaning. And then the AI just enhances and confirms what you're seeing to allow you to live into that standard of care every day in your diagnosis and your treatment planning.
Can I take it one step further?
Yeah.
It's a bridge between the collaborative diagnosis with the hygienist and the dentist. So we talk about this bridge between, the diagnosis of the insurance company and the dental office. But when the hygienist is timid and they are ready to stop doing bloody prophies, but the dentist isn't fully on board, we now have more leverage to say, there is a standard. The American Academy of Periodontology says we should be looking at these 3 things. And I can see on these radiographs, the patient has this much bone loss. And when we see this, we should be doing that. They also have this comorbidity. They also have this probing depth that has bleeding on probing. Doc, I believe we should be doing this. And it makes the hygienist, again, just have more legs to stand on for that collaborative diagnosis.
Shout out to Inspired Hygiene, because that's actually what happened for us with one of the coaches we brought in our practice. Was we had 3 doctors and 3 hygienists, and they were not probing the same way. Everybody had different education, different background. And so as much as we said we had a standard of care, they were probing, and I'm not clinical, right? So they were probing differently. And we were talking about it differently. And one of the things that came out of it for us, because our hygiene wasn't growing, because there was confusion, not spoken confusion, unspoken confusion amongst the clinicians. And so we all had to get to a point where we stopped and said, what is our standard here? And as soon as the hygienist and the dentist were on the same page, all the hygienists were on the same page, we were probing the same way, it grew for our practice. So that is, you could put AI on that, you're still going to have confusion. You're still going to have, it's not going to fix that problem, because that's getting calibrated as a team.
Yeah. I like that term you used, unspoken confusion. And that is a really good explanation of what a lot of times, because practice owners are typically the ones that are calling us asking for help. And what we find is most of the time the hygienists want the help too. They just are confused about what is the help we need.
Right.
where is the obstacle here? And they're just doing the best they can in the systems that are or are not being used in the practice at the time. So one of the things this brings me to as well that I hadn't thought about before is the level of team development and elevated skill of team members when they are when they are truly integrating and becoming very skillful with these technology and AI applications. So, right now in our industry, I've talked about this a lot on this podcast. Hygienists are in a very strong position from an employment standpoint. I don't think that that is going to be the case forever. Things are changing with legislation and that all kinds of different things, and just like in everything, this goes through cycles. And so I would encourage all team members, hygienists and all team members, like really look at this as a way to continue to develop your skill and develop yourself as a relevant professional. Because when you can step into a practice and you truly, maybe you haven't used that particular software, but if you have, like you said, Alicia, gotten in the weeds with another, radiography analysis software, you can translate those skills and you can speak to that and you'll be a very valuable team player.
I
I think,
wholeheartedly
go ahead.
I was just going to say, I believe that all hygienists should be placed at a very high value in their practice and be compensated fairly. Um, Everything considered, I strongly believe that if you're going to be compensated and placed at a very high value in your practice, you should be able to do or be trained on most of the updated versions of AI and radiographic interpretation, any type of video or digital technology that interprets your patient's oral health. But if you're not able to do that and you want to, you should be reaching out and asking for support because we all signed up to be lifelong learners. So if you're not sure on how to get access to that training, there are people like all three of us that are willing and able to find resources for you, if not be that resource for you ourselves. But I think the first step is really putting yourself forward and saying, I do want to be placed at a high value, but what do I bring to the table?
Yes. Yeah.
And I would add to that, there's a lot of people who are like, well, I'm not going to be replaced by AI, or I'm worried about being replaced by AI. I'm not, my suggestion is for people not to realize that or think that you're going to be replaced by AI or that the way we've always done it is the right way. But I am concerned that in 6 months or a year from now, you're going to be replaced by another human who does embrace AI.
Mm,
So, because if I'm hiring somebody and it takes Rachel, 6 hours to do something that it takes Alicia, 6 minutes to do, I'm going to have to hire, like, there's not going to be a choice because I'm a business owner at the end of the day, right? It's about
yeah.
efficiency. So and this technology is not like sit back and wait till it is here. It is coming. It is not perfect, but it's growing. It's got applications we can use right now. So really starting to reset. What's that?
Yeah.
It's already in our offices, just
Yeah.
underutilized.
Yeah. So to that point, Laura, we've talked a lot about clinical applications. What are some AI applications that are already in practices that maybe we're not all aware of? And what do you see coming? And then I'd like to talk about maybe some clinical things that we see coming as a good way to wrap up.
Yeah, for sure. So there's a lot in the front. So because of the pearls and the overjets of the world that came out, right? That's why we're all talking about it, because dentists love clinical. So that's why we're here. But what I love is the office administration stuff of where it's going to save us time in the front. That being said, where I keep saying AI is here, but it's not perfect and it's getting better, is that it is not ready for 75% of what we do in the front, but it will be in the future. So one of the things that I see a lot is there are companies who are saying, plug in AI, it can answer your phones, it can verify your insurance, it schedule your patients. I say, hold on, pause, because the three most important things we do in the front office is our phones, our insurance, and the schedule. Right?
Mm-hmm.
I would not take a brand new employee and say, here, answer the phones, bill the insurance, do the schedule. We would just have a mess in the practice. So typically we start a new employee, train them really well on the phones, and let them answer the phone. So that's one of the things right now we have it at Mango. We have Margot, and she is trained to answer the phones. So nights, weekends, overflow. When you can't get to the phone, it's trained by somebody who knows dental to answer the phones. There are insurance AI agents now that can, because God, if we can get rid of calling insurance companies, man, talk about getting our time back. There are
Right.
companies who are getting better and better with AI now, with the insurance. Now, the dental insurance is pushing back. So there's going to be some, like you said, there's some things going on there. And eventually AI will help us with the schedule. It'll help us with so many things. But right now, I would say pick a problem. Our phones have always been a problem. We miss 30% of our phone calls most of the time when we're in the practice, nights and weekends where people are not leaving voicemails. Patients want to talk to somebody. Margot or whoever you use, as long as they understand dental, can have a conversation with a patient, get the information to your team so they walk in on Monday and they have everything that they need. There's also applications you can use in the practice, and I talk about this in Brush Up on AI, is there's free applications, ChatGPT, Claude. Now, you don't want to put any patient information in there, but maybe you want to put together a implementation program or a team meeting or an outline of how to have a difficult discussion with an employee or a patient. Like there's, writing an email to your patients about dropping insurance, making your email, your marketing, social media. Like there's so many applications right now that we can use free AI while we're looking at all these other ones that want to charge us this and that to get it in the practice, that is going to make you better in your practice right now without go spending, $1 million. So I would say really looking at where's your team spending time. Is there an AI tool or an application of where we can use AI now, or planning for it for the future? Like this is on the roadmap that we're going to do that in the future, but it's not quite ready now.
Yeah, I think I'd rather see teams. I mean, this is true for all of us, and whatever we do is like go full on with one or two applications rather than dabbling in 6 different ones.
Mm-hmm.
And that's typically what we see when we go in practice is like, well, we have this product for this, we have that product for that, and we have that, and that's just in the front, the business team, So yeah, figure out which one, like you said, solves that problem, and then go really full on and fully integrate and fully understand it, because that's just going to help you with the next thing that you bring on. Okay, so let's talk a minute about what we see coming in the future. Any industry insight, Laura, from your part, or clinical insight? I know I have some dreams about technology that I want to come to pass, but yeah, what do you see?
I believe that one day we are going to have an AI run practice with humans being the front of this, right? With our patients and human oversight, where my AI receptionist will talk to the patient, connect with the AI insurance agent that will call insurance, which will connect to the AI scheduler, which will help schedule the patient, which will talk to the hygiene AI, which when you walk in as a hygienist, you'll know everything about that patient. You won't have to come up front and say, can I do fluoride? And are they covered? Like everything's going to be there. You're going to know in the conversation that we had, the patient's going to their daughter's wedding, and you're going to know their insurance. Then the doctor's going to come in and know everything that happened in your, like, I believe that we are going to have this AI backbone. Not all of it's ready, of course, but if you start to embrace one part, just in hygiene or just on the phones, you're already cutting edge. So that when we plug in the other one, what the companies are doing on the back end is they're currently figuring out how can they work together, so that when we do plug in a second AI or a third AI, they're gonna connect. And that's not today, tomorrow, or the next day, but it is in the future. So starting to embrace it now in an area of your practice that can use it now puts you ahead of the curve to be ready for the next evolution.
Yeah, love that. Alicia, what do you think? Any clinical insights?
Yes. I'll give you an analogy really quick. So if you're not scanning, you should be scanning. For my father, he's 67 now, but when he was about 55, maybe 56, he was still using a flip phone. And I said, Dad, I'm going to give you my old iPhone. I had an iPhone like 4 or something. I'm like that. I'm going to give you my old iPhone and you're going to learn on this one because by the time you're ready to transition into an iPhone, you're going to be so blown away. You're going to want your
Oh, yeah.
I'm saying this now to say if you're not already scanning, please start scanning. So I'm going to throw a couple of acronyms out here because Align Technology just loves acronyms. But something that's new on the market right now is Align's OHS, which is the Oral Health Suite. And it's a
Mm.
really cool way to integrate patient engagement in the dental hygiene chair. So if a dental hygienist is not really sure on where to start the conversation with the patient, you literally just pull up the oral health suite and the patient almost picks what do they really want to
Mm.
talk about with you. Is it my bite? Is it my alignment? Is it, the shades of my teeth? And they literally sit there right for the patient to really engage with the clinician. So within OHS, the oral health suite, you have iOS MTS. And that is something I recently learned about and it just blew me away. So iOS MTS is Invisalign Outcome Simulator, which is on all Invisalign iTero scanners. But the MTS is the multi-treatment simulation. So within your Invisalign Outcome Simulator, you have the ability to show the patient where their teeth would be should they properly align their teeth. But the added benefit to using multi-treatment simulation is you can not only show the patient what their teeth would look like post-alignment treatment, they would also have an option to see what their teeth would look like post-alignment treatment with cosmetic options. So if
Yeah.
you peg laterals, this multi-treatment simulation will show what your teeth look like in alignment and then in alignment with two potential veneers on your peg
Yeah.
laterals. It's a beautiful opportunity for us to fully engage with our patients. So within Hands on Demand, we do talk about the Invisalign Outcome Simulator, not necessarily the multi-treatment simulation just yet because it is so new, but I would love for everyone to just start somewhere. Start with the Invisalign Outcome Simulator, get really comfortable with it. So that way you can start to engage with your patients. And when you have the upgraded iTero Lumina software, then you can start to integrate the multi-treatment simulator or MTS. And then my hopeful wish for the future, this is my grandiose wish as an AI scanning lover, is should we scan our patient's mouth today and we see that they have malocclusion or we see that they have generalized attrition or generalized recession, if they don't heed our recommendations in terms of clear aligner therapy or a crown or whatnot, wearing a night guard, what would their teeth look like 6 months from now, years from now, 12 years from now?
Mhm.
Could we see the cascading effect of the crowding teeth? Can we see the can we see the built up calculus? I would love to see that in the future. So
That's an awesome idea.
if
Wow.
you're out there listening, I would love to help with that software. I would so love to be like a pilot user or even just give my brain power and energy to that. But that's my big grandiose wish because I don't think patients truly understand what we're saying until they can see the end result of it. And most patients typically say yes once they've had some deterioration. And then they say, I
Yeah.
don't want more of that. So if you could see what I'm saying to you, almost as if you're telling someone, if you don't wear your seatbelt, or if you drink and
Yeah.
drive, this is
Yeah.
what could happen, right? And then you
Yeah.
get horrible image in the end, and you're like, I'm gonna make better choices.
Mhm.
So
That's a
that is so cool.
mhm.
And if we can simulate what they would look like with better aligned teeth and veneers, why can't we, when I say we, why can't these technology companies simulate what it would look like if their teeth get more crowded and this decay? That doesn't seem like that much of a stretch.
Well,
So,
and that's what
Factor in the age potentially, and then how much crowding they have. If you
right.
already scans from over the years, you can kind of pace how fast this progression is happening for this patient. I don't think it
Yeah.
would be that hard. Again,
Yeah.
I am so happy to put my brain energy into that project.
that's awesome. And that's one of the reasons I saw this technology. I was actually at a women's event at Align 2 weeks ago, and I saw this technology and I was like, oh my gosh, this is amazing, right? So one of the things I do want to mention as company dentists or teams are looking at AI, there are AI companies who don't know dental, and there are dental companies who are not embracing AI yet. And what you really want to do, I think, is to find the dental companies who are embracing AI, because they understand what happens in the hygiene. They understand what happens in case presentations, and they're embracing the new technology. I saw this technology you're talking about 2 years ago with a one-off company. Like they were like, look, we can do smile designs in AI. But that's one more thing I got to pay for in the dental office. One more thing I got to open. One more software I got to use. When I saw a line with, I was like, oh, that's awesome. Right. And it's right in the workflow, right? It's kind of like our Mango AI notes. It's right in your workflow. You're already using the phone system. Just let it do this thing. So as you're looking at the shiny new tools, I think there's going to be a lot of companies coming in who are not going to be here in 3 or 5 years, but some of the well-established companies that are here and embracing the new technology, it makes a lot of sense to continue to work with them.
Yeah. So I would say, to wrap up, just everybody keep your eyes open, whether that is, at events, go to the vendors and see what's there. Follow speakers like Alicia and Laura that are out there, creating awareness around this technology. And also they have practical experience on the application of this technology and how to really make it work for you. And then I would say, just look inside your practice first. Is what do you already have that you haven't fully, that you're not fully utilizing or isn't fully integrated? And how can it solve some of those problems for you as you're moving into this next part of, this next year? But like I said, when I started this season, 2030 is not that far away. And that sounds crazy. And I mean, it's going to go fast. We're going to be there before it's coming, whether we want it or not. So, just look at that. So our goal is just to help you all thrive, just to have exciting time in dentistry and patients get incredible clinical outcomes. So thank you both. We should probably do a part 2 of this at some point. But this was awesome. Thank you, Laura. Thank you, Alicia.
Thank you. This was great. Way too much fun. Thank you.
I know. Thanks, everybody, for listening. Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com. And as always, stay inspired.